Hello everyone, my name is Dr. Kimberly Dike, and I'm a medical doctor trained in gastroenterology, nutrition, and internal medicine. So today I am talking about breast cancer, and I'm just going to go over some of the basics very briefly, just so you have an idea of what's important. So let's get started. First things first, what is breast cancer? And what is cancer in general? So normally cells in the body work together to carry out various functions. Sometimes the cells become damaged or bad cells, or the DNA becomes damaged. So the body's way of dealing with bad cells is that they are programmed to just die. Now, sometimes those cells don't die, and instead they continue to replicate or divide very quickly. And this becomes a problem because it can interfere with the function of normal cells, and it can interfere with those cells that are healthy and just in the area, or it can travel throughout the body and cause problems elsewhere. When it has traveled to other places in the body, we call that metastasis. We say the cancer has metastasized. And when that happens, it becomes a little bit more difficult to treat. So when these events occur in the breast, it's called breast cancer. And these cells can grow rapidly and become clumps and cause changes in the breast that some people are able to notice. However, some people don't notice these things. So one of the important aspects of medicine is early detection. That's catching the breast cancer before any symptoms appear. There are different ways that breast cancer can be evaluated, but one of the primary ways is through a mammogram. There are other things like an ultrasound or an MRI that may be utilized while evaluating for breast cancer, but mammograms have been the go-to. People around the age of 40 should discuss when a mammogram would be appropriate. Now, there are instances where people should be evaluated at a younger age. So it's important to discuss what your risks are with your physician so that both of you can identify an appropriate time for you to start screening for breast cancer. So I mentioned that some people have symptoms and some people don't have symptoms. Well, what are these symptoms? They can vary. They include changes of the shape and the feel or size in the breast, among other things. So some people may describe lumps, bumps, the texture. It could even look like an orange peel. Sometimes there is discharge from the nipple. Other changes include redness of the breast, a change in the color or the texture, or maybe even a warm sensation in the breast that just does not go away, or pain in the breast that doesn't go away. Other symptoms people may identify or notice include bumps or painful lumps in the armpit, swollen lymph nodes in the armpit. Those are some of the main things that can be identified. It's important also to understand that some of these symptoms may not be breast cancer. There are other conditions that are benign meaning not cancerous, that can present similarly. So it's important when you notice these changes in your breast or any changes in your breast that you let your healthcare provider know and let them use their expertise to determine what the next steps are and what should be done to make sure that it's nothing that should be concerning. Don't jump to conclusions, don't freak out because you don't know what it is. There's no point in stressing yourself out and worrying about something that you don't know what it is. You don't want to create more stress for yourself. Find out what it is first, all right? Also, sometimes cancer goes missed. We can't always feel it. There isn't very strong evidence out there saying that people should do regular breast exams at home to check for lumps and changes, nor is there strong evidence saying or benefiting getting regular every year, getting a breast exam. However, oftentimes people notice changes in their breasts, just doing normal everyday things, taking a shower, getting dressed in the morning, taking a bath. They just notice it. So what is important and what people can do is to just pay attention to your breast. what they typically look like, how they typically feel. And this includes men as well, because men, yes, can get breast cancer because they have breast tissue as well. So it's important for both men and women to pay attention to these things. Again, and I say this all the time on Instagram, do not obsess. It's not healthy. It's not going to get you anywhere. It just causes you stress. Don't obsess. Just pay attention, have an understanding of how your body feels, what it looks like, so that when things do change, you're able to bring it to your healthcare provider's attention and get that taken care of. So once breast cancer is suspected, what's next? The definitive way of diagnosing breast cancer is with a biopsy. Taking a sample of the suspected lesion or a cancer and sending it to the lab so that it can be evaluated and studied to determine whether or not it's truly cancer. That is the way to diagnose cancer. Can't just diagnose it by feeling and looking. Got to take a sample. So what happens if cancer is diagnosed? There are different treatments for cancer, but a lot of that really depends on what stage the breast cancer is in. Is it in a later stage? Is it too advanced? Has it spread to a lot of areas in the body? Those factors play a role in the type of treatment, which again is why it's important to have early detection. Different treatments, in no particular order, include local treatment like radiation and surgery, removing the cancer, removing the breast. Other treatments involve things like chemotherapy and hormone therapy, among other things. And it really requires a team effort from the family and clinicians, because it's a very, very sensitive subject and very emotional and stressful for both the individual who's diagnosed and the family. So it requires a lot of support, and there are support groups out there to help. So that's all I'm going to talk about in this video. And I do have another video on risks for breast cancer and prevention. I wanted to do that separately because I want to go into a little bit more detail. And so depending on when you're watching this video, it may or may not be up already. So definitely keep an eye out for that. All right, until next time, ciao.